There's been quite a few very interesting questions in the previous session. We're hoping for the same for this session as well. I want to introduce thus the plenary session number 12 and our last for today, establishing a public trustee program in York Region. There is a lack of dedicated public trustee program in York Region, unlike Toronto, where a system of trustee vendors is in place. This topic will discuss this absent leaving vulnerable population without essential services to manage their financial and legal affairs. Public trustee program protects assets for individuals at risk of exploitation and mismanagement, addressing gaps in services currently offered by family members or overburdened community organization. The panelists will speak of the program, its impact on ensuring financial security and legal support for those unable to manage their affairs independently, thus touching on reducing the risk of homelessness, financial instability, and legal complications. The panelists will also speak of what this system can provide to assist these vulnerable population and highlight the impact of financial mismanagement on housing stability and legal outcomes. Underscoring as well the long-term cost savings and increased efficiencies that such a program would provide to the social service sector, legal system, healthcare infrastructure in the York Region. We have two panelists. We want to welcome them. Jalal Matazavi, who is the clinical supervisor at ASCO with an expertise in mental health, addiction support, and housing first initiatives. And Michelle Kalea, who is a case manager, housing first with ASCO, experienced in eviction prevention, financial planning as well for vulnerable population. So we want to welcome you both so very much for joining us this afternoon and taking time out of your schedule to educate us on this very interesting and important topic. You can share your screen, and I invite everyone again along the way to put your questions or topics you would like the panelists to address after their session. Thank you.
Thank you very much, Marie, for your great introduction and giving us a voice to present this issue, which we believe it would be a missing point in York Region. And also, we believe that it doesn't exist in so many other areas, and it would help the community in developing more stability regarding their housing and their finances. Anyways, good afternoon, everyone. Welcome to this presentation, which will focus on the advantages of having a voluntary trustee program in your region. This is a community support for people who are interested in having financial mentor to help them with managing their limited income by ensuring housing stability. During this presentation, we have various aspects of voluntary trusteeship which will be addressed, including why this topic matters, what is a public trustee program, and what is the gap in your region, the populations who are targeted and are impacted, financial consequences and cost comparisons of having and not having this program, housing stability, empowerment and mentorship, the program model, which already exists, sustainability, roadmap of establishing this program in your region, and reaching home models and call to action. And at the end, we would have some time for questions and answers. So the current trend in York Region involves an increasing number of people who will be eligible to access supportive and transitional housing programs. This cohort of applicants are likely to include people who would benefit from financial management mentorship in order to prevent becoming behind in rent payment and being evicted. Between 2019 and 2023, the number of people experiencing homelessness for longer than 6 months increased by 380%, which means 4 times. And between 2021 and 2023, the number of encampment that in York Region that the York Region Outreach Services visited increased by 330%. And this shows, like, what is the drastic trend of increasing of homelessness and the risk of homelessness in the region. And that would apply to the other regions as well. But however, there are different reasons of, like, we want to present this topic here. So why this topic matters? Many vulnerable individuals in York Region lack the skill to manage their limited finances to prioritize paying shelter costs. Without assistance, those on OW, Ontario Works, and ODSP, Ontario Disability Support Program, the other low income, or those exiting homelessness are at risk of eviction and financial exploitation. A voluntary trustee program provides early intervention and financial empowerment that these people require. So managing very low income is very difficult very different from having financial literacy. It requires specific money management skills to prioritize finances and services. To be specific, a single person who receives ODSP and has housing receives a total of $1,368 per month to cover the cost of all needs, including housing, utilities, transportation, phone, food, toiletries, non-prescription medication needs, clothing, and all other purchases. If that single person who receives ODSP does not have housing, they receive only $786 per month to cover all those expenses. A single person who receives Ontario Works and has housing receives $733 per month to cover all those expenses, in all those costs, including housing, utilities, transportation, phone, food, toiletries, non-prescription medical needs, clothing, and any other purchases. However, if that single person who received Ontario Works does not have housing, they only receive $343 per month, just $343 per month to cover all of their expenses. So given this low income, it is reasonable to consider that there is a cohort of people who would benefit from financial skill mentorship through voluntary trusteeship. And that number is much higher now, considering the figures on the previous slide. And that those numbers belong to, like, the time 2023, and we don't have, like, the statistics for 2024, and we are not 2025, but, like, with all, like, the full studies, we have a trend, and with all these economic, like, problems in the society, we consider the number of homelessness is increasing, and people at those risks are more, and the lack for such a support and requirement for that is more prominent. So what is voluntary trustee program? Trusteeship program provides specific support to people who need short-term assistance in stabilizing their housing situation and preventing eviction. They support participants to build money management skills to maintain housing and establish independent living. It is a collaborative financial management support. This gives participants a chance to regain stability while transiting to their new housing obligations. The unique program gives participant autonomy to make financial decisions while having the opportunity to receive guidance and education. Voluntary Trustee is a community service-based program which supports people who require financial skills mentorship. It focuses on target cohorts, including people who live with various vulnerabilities. The current criteria for trusteeship funding is exiting homelessness or facing evictions due to rental arrears. This service is always collaborative and supportive, as mentioned. The trusteeship timeframe goal is 2 years. And where that 2 years is coming from, it's based on the funding available right now, which we would explain later. Just something to remember is this program does not have any connection to the Office of Public Guardian and Trustee. But that office and the services associated are for people who have lost their capacity to make decisions by themselves regarding different aspects of their life, like deciding about receiving treatments or like controlling their finances. And those people need somebody to have the power of attorney and act as their guardian. But however, people benefiting from public voluntary trustee program are people who have the capacity to make the decisions, but they don't have the skills to manage their finances, and they need some support and mentorship to learn those skills. However, if we maybe look to those figures for people on OW and ODSP, I think it's making magic to balance your finances. Even I don't have that literacy myself. So imagine for people coming out of homelessness or dealing with mental health and addiction or some other stuff, for people at their old age, it's very hard for them to to learn, to have those skills. And mentorship is a great support for them. The voluntary trustee collaborates with individual regarding rent and bill payment through direct deposit. It should not be always direct deposit, but some people prefer that, and that's an easy choice, so they're not concerned every month to remember the due date of their rent. They also help with budgeting and coaching, so they help them like prioritize their expenses in the month and like how to keep the track of them and pay them at the due time. They also help with preventing financial exploitation. So people who do not have those skills, like some elderly people or the youth, they are more vulnerable to be financially exploited or being like targeted by predators. This support would help them to avoid those exploitations. Also, the public voluntary trustee helps coordinating with housing programs for the individual and communicating with the other like agencies that are involved in the housing support for the client.
So there's a gap, and the gap is that York Region doesn't have any such programs in place. There is a system of voluntary trusteeship programs in Toronto, but we don't have any here. As a result, many residents, particularly low-income people, ODSP, OW, low income, don't have the resource. It's just simply not available. And the absence of such programs in York Region does represent, really a critical service gap, and that this proposal aims to address. I would respectfully suggest that the service gap is getting wider as we have noted the population of people that are unhoused in York Region is increasing dramatically. And so to illustrate some of the needs and the ways in which the gaps can be filled, we'd like to talk to you about a few clients over the course of this presentation. We'd like to share some stories to illustrate the kind of things that are really happening in the absence of the voluntary trusteeship programs. And I'd just like to red flag that the examples we'll be discussing are actually clients that this housing team has encountered. So client CB had been evicted from in the past, and they actually acknowledged that they didn't have the financial management skills needed. They had agreed to a voluntary trustee program with mom as trustee. The ODSP was sent directly to mom, and then she paid the rent and the phone bill. She also, paid for the groceries and managed the money for CB. Mom didn't have financial skills to, mentor, nor coach any kind of learning. Rather, her way of managing the low income was that she used her own money to fill financial gaps. And this really became a problem when mom started filling the financial gap when CB's roommate moved out. And this was a significant amount of money. Eventually, the situation led to arguments and a family breakdown when mom just had no choice but to impose financial limitations, because those short-term contributions regarding the rent just, simply weren't sustainable. And CB insisted that they did not want another roommate. You can imagine the conflicts that occurred. CB became so frustrated. He became so frustrated with the lack of control and his financial situation that he actually completed suicide. It was just such a sad story for CB, and it was actually very sad for the family as well, and for mom. Apart from that outcome for CB and just not having control and kind of that loss of autonomy and what it did to him. Coincidentally, like, mom also became quite ill. In fact, mom developed a life-threatening illness. And such situations are not uncommon, as caregivers are vulnerable to illness in general. And that's just the consequence of the 24/7 stressors that occur when these kind of dynamics are inserted into the family. This, of course, is co-occurring with caregiver inclination to not seek medical care in a timely manner. And again, and then that has a lot to do with caregiving and the needs of the other person. If anyone's interested in looking further into unmet needs through the lens of the caregiver, the Ontario Caregiver Organization, incidentally, is a really good resource. But let's get back to talking about housing. Statistics Canada identifies that the most common reason for people losing housing is lack of income. In fact, according to Stats Canada, among adults aged 25 to 65 and over, the main reason is insufficient income. Managing limited finances is a skill that can be taught by trustees. And that skill can mitigate the loss of housing and all of the other personal consequences that come with that loss of autonomy. There's also a financial consequence of inaction just in terms of society in general. Unaddressed housing stability, does lead to long-term societal costs that could include, the costs that have to do with the eviction and all that surrounds that. That includes emergency services. It includes, even the cost of incarceration. All of these things are pieces that need not tax society if a person is housed stably. Currently, there have been many announcements regarding plans to increase the number of affordable housing sites. We also have an increased number of people that are coming to us that may need support in managing their finances so that they can maintain their housing. when they transition from being homeless or in a situation of having arrears. The support of the financial voluntary trusteeship can support establishing or reestablishing housing stability. So I wanted to share another example. And JD is a York Region resident. He is a person that had housing through the support of a family member who acted as a financial trustee. The example of JD illustrates the cost paid by the client, the family, and community resources as well. So JD is a person in, in their 40s, living in York Region, history of mental health, which also includes an impulsivity piece, and they are on ODSP and unable to work. With the only available trustees, the caregiver, again, the caregiver doesn't have the capacity to mentor financial skills, and this dual role is this mentor. I'll try again. This trustee is a sibling, and in particular with the sibling, there was this dual role that was occurring. Again, it ultimately led to disagreements and discord. It really affected the family, and ultimately, the caregiver had to face real burnout and knew that they had to step back, and they did step back from the trusteeship, leaving JD to manage his own finances. JD was eventually evicted, became homeless, and in the instance of JD, there were multiple interactions with the police, and there were several mental health hospitalizations.
So who benefits from public trustee program? Voluntary trusteeship have the capacity to support various cohorts of people, including senior, which have lost some of their capacities, including some intellectual capacities, and but they are still not at the point that need a guardianship. Youth on OW, there are some youth in particular, they might stay in shelters, and they might have like some government support, and this is their first encounter with the society, so managing finances is something new to them, and they are not skilled. None of us get like those lessons at school or in the family, so this is skills that usually gets developed through time, and these people do not have that chance, and that gap and lack makes them very vulnerable to the exploitations. The other cohort is low-income individuals, such as those on ODSP and OW recipients. That might be any of those cohorts above and below. And also people exiting homelessness, which people exiting homelessness, some of them has been homeless for a long time, and they have not earned, or they have forgotten so many of daily skills, even doing the chores, and they need case management and support to regain or learn those basics daily life living skills. And when it goes to financial skills, for sure they are lagging a lot there, and having somebody to help them and navigate them in a friendly manner to learn to to manage their finances is very helpful for them, and in particular to help them sustain their housing stability. And also people with mental health and addiction, there are so many overlaps with these different cohorts, people might fit into different of these categories, and in particular those, it's obvious for people who deal with mental health and addiction, they might have very different challenges in organizing their life, and mentorship here on their finances would help them prevent homelessness or like developing better housing stability. Also, high-risk renters, for any reason, people who owe arrears, they also benefit from such program. So the benefit of volunteer trusteeship has a wide scope of advantages, including prioritizing rent payment, which is the most crucial, expense that they have for a month, and it's important for keeping their housing stability. Avoid arrears and eviction, which is a consequence of being behind their rents. Strengthen tenant-landlord relationship and building trust and a good relationship between them, and reduce housing disruption. So here is a flow chart of how this process happens. So when an individual is low income or they are high risk, they get the trustee support, they apply for the program, they get accepted, and then the trustee helps them to prioritize their expenses and assure their rent and bills are paid, versus the housing, its expenses, then the cell phone, then the food, and then sanitary stuff, and then to the rest. And what would be guarantees the stability of their housing, and that has a direct impact on improving their health and stability, and also the stability of the family, and also the community.
So really, what we're talking about here is empowerment. So just, in the examples that we talked about, the client examples, empowerment and autonomy are two of the big things that the voluntary trusteeship brings to people. Empowerment, autonomy in developing a really a good collaborative trustee and client relationship. Through that, they're able to succeed in budget coaching and goal setting, and that autonomy building piece. All of this is in the context of the trustee being in the neighborhood. The trusteeship programs are community-based programs where that collaborative relationship can occur because that person-to-person relationship is built. That's very different from the kind of family trusteeships where a kind of a paternalism evolves, as we've seen in a couple of our examples that we've talked about so far. Really, trusteeship is a tool to facilitate independence and autonomy. And independence and autonomy is, really evident in our next client example. AM is a Toronto resident, and AM was able to access a trusteeship program. So in this instance, this is a person who had a history of unstable housing from childhood. The access to that Toronto trusteeship really changed his life. So in childhood and youth, he went from family back and forth between family and foster care. As an adult, there was a transient lifestyle and there were years of incarceration. Following the incarceration, there was a history of accessing the shelter system and being street involved for a number of time. So this was, a person who would be very challenged to exit homelessness and adopt the responsibilities that are required to maintain housing. AM was accepted into a supportive housing program and had access to a voluntary trusteeship program. And with that, they were able to obtain and maintain housing. And that housing piece, is the beginning of establishing housing or stability in the rest of life. it's really nice to see the relationship grow there between the trustee and AM as well. It also showed really the difference between the intensive case management type of work that I do with the homeless clients and the very specific support of the trusteeship. Worked very well to AM's advantage and wellness. And I'd like to contrast that good outcome with DD, who's a York Region resident. And so DD received addiction support for gambling, and they've made many steps towards recovery. DD made many changes, including attending counseling, and was to the point where they were actually accepted and ready to go to bed-based rehab. All this effort was jeopardized when they unexpectedly were evicted from their unstable housing just before they entered bed-based rehab. And that eviction did have everything to do with financial management and the skills needed to follow up with landlords. As an OW recipient and having a gambling addiction, it's very common. DD was disenfranchised both from family and friends. He had really burned everyone out. He had accessed the shelter system. He completed the bed-based rehab. He had made many gains in his addiction. He completed the bed-based rehab, but was unable to make any kind of support with finances, which is actually quite critical in the action steps with addiction gambling. He was discharged from rehab to unstable homelessness with no financial support system in place. And he didn't return. He didn't return for aftercare. He didn't return for any other supports. And we don't know what happened to DD. We don't know where they are today. This story illustrates the human cost of addiction. It also illustrates how access to voluntary trusteeship can increase the cost effectiveness of providing supports such as bed-based rehab.
So with respect to all the information shared so far, we are proposing that trusteeship program follow a similar model to the funded program in Toronto. The proposed model include being voluntary consent-based participation. So it's not forceful, and the individual can withdraw from that contract or agreement anytime and take the control of like their finance. They already have it, but sometimes, like for instance, in direct deposit of the rent, they might give the control of direct deposit to the vendor, but they can, anytime they can withdraw. There is no obligation to continue that. And the second, the issue is being a local trustee vendor. So these services need to be delivered by a local agency to be accessible. Also, the current available funding for the program is restricted to the residents of the service area. And this is one of the challenges that people, for instance, right now living in New York region or other regions, they cannot benefit from the service available in Toronto. And that's part of the restraint placed by the funder. We will talk about the funder later. And so if we want to have this service available in York region, a vendor or vendors in York region need to apply for the funding and provide that service to the local people. The other pieces program length be up to 2 years. So the intention of the program is not providing long-term, life-term service, but to take like up to 2 years to empower the individual and support them until they gain the capacity and the power to manage their finances. However, we agree that there are some cohorts of some people who might need the extension of this service. But unfortunately, regarding the current funds available limits, the maximum time to benefit from this service is 2 years. The third is coordinating with housing and support agencies. So the volunteer trustee would act as the advocate for the individual and does that communication. And the other one is pinpointing the fundings. But right now, there is a federal funding source available, and that is restricted to the conditions above that we explained. However, we are certain that there might be other local or provincial sources for extending this support to more people, because there is a limit based on the federal funding available to the number of the people who would benefit from that. If you go back to the figures we shared about the increasing number of the people who are considered homeless like that, and those numbers consider people who have been homeless for 6 months and not below that. And also, it doesn't include the number of people who are precariously housed, like they are couch surfing, or other people who are at the risk of homelessness, and they would benefit from this service a lot. So to extend this service and also include more comprehensive services, or increase the length of the service for people or other cohorts who would benefit, or like some people with just some level of intellectual disabilities who have the capacity to make decisions, but they don't have the skills, or elderly who might need extended support. We need to have more resources for the funding. So there are programs right now that validate the value of taking time to address this need. We pinpointed some supports available in Toronto area. Some agencies are providing sort of like volunteer trustee to their clients, which is not very common. However, one program or agency which is providing this service exclusively is the Neighborhood Group Community Services, TNG. If you go to their website on the first page, you would see the statement that Trustee program has a 98% retention. And that's a huge figure to claim. And that shows the value of providing such a service. We believe that the realistic model for York Region needs study and adoption of the services which is already existing in Toronto area. However, even if we follow the same direction, it's not a very complex service to provide. We are gonna be, in a great position. So the federal funding of such program is currently through the Reaching Home program. Reaching Home is a federal community-based program to prevent and reduce homelessness across Canada. It invests $5 billion over 9 years from 2019 to 2028. It's a key funding resource for community initiatives like voluntary trusteeship program that promotes housing stability. Reaching Home funding for York Region is managed through the United Way for Greater Toronto. So for the vendors and agencies who might be interested, this is a great place. If you search, you can get all the information required, and where you need to apply is the United Way of Greater Toronto. This is what we have heard through our investigation, that even when the time for funding comes, they send an email to majority of the agencies, even in York Region. But unfortunately, so far, up to this time, no agency in York Region has applied for this funding, and the service has not been available. But the funds were there for many years. So the next grant proposal are anticipated to be around 2027 for the time after 2028. So we have almost 2 years to get prepared, do the need assessment, test the waters, prepare a proposal, and submit it to the funder. So, an implementation roadmap may occur over 4 phases. The first one is need assessment. Well, we didn't have the capacity to do a study and identify like numbers and like do the statistics about people who will benefit from this service. But like the current figures are also already convincing that there are many cohorts who will benefit from the service. But we understand like in the agency for convincing the boards and like the management to provide like this service, we might need some like assessment, and assessment would be helpful. The phase 2 would be consultation, might be consultation happening between partner agencies or local authorities, and like, how we're going to pursue and proceed and who's going to apply for this funding. And the third one, stage would be piloting the program. What we mean piloting program, we are not creating a new thing here. We can just follow the steps of the agencies currently providing this across Canada. However, it would be great, if 1 or 2 vendors start with this and do some, I can say practice and there see how we can improve or localize, this program to the York region or other regions who are interested in applying that. And then we believe that regarding the results that we highly believe it would be promising, then we can scale it up and maybe look for other resources to expand the program, provincial or local, resources for more funding. And the timeline, as we said, might be 6 to 24 months. If you have another funding source, people can start earlier. Otherwise, we have 24 months to prepare for the next funding period. So thank you very much for your consideration and time. Now we are here if there would be any questions or thoughts to be shared, and we would be happy to answer.
Thank you very much for this presentation. I will go to questions. And I invite everyone to put questions in the Q&A or in the group chat, and I'll wait for those. But in the meantime, for the regions that don't have a voluntary trusteeship program like you do, where, maybe it's a difficult question, for those regions who are interested in setting up such a program, where do you look for the funding?
But the current funding available already is reaching home right now. If anybody who would be interested, they can look into our resources. References on the slide, we would share it with the AJTP, and it will be there anyways. And if somebody searches reaching home, everything is fully explained there, and it will be directed anyways to United Way Greater Toronto, and even the contact person there for that program in Greater Toronto area, and it is mentioned there. So it's a very great company. But for the other regions, I believe the start point might be reaching home again. Do you think so?
Yeah, so on the Reaching Home website, there is a breakdown of every region, and then drop down menus that identify the agency and the contact person. So it's not hard to find. Your starting point is the Reaching Home website. And that is the Government of Canada federal.
Thank you. So anticipating maybe a question that was coming. You're just asking also for those who have asked, is it possible to share your presentation? That would be great if you can send it to the email that you received the invitation from. It would be really helpful, and we'll make it available after. There was a lot of information in short time. I was taking notes, but I'm sure, listening and taking notes sometimes at the same time is not the best. So that would be really wonderful if you can share this with us.
Within the research that we did for your region, please feel free to email because we can save you some of that research time and share some of those details with you.
Okay, that's wonderful. Thank you very much. I think it was very comprehensive. I don't see other questions coming, so thank you very much for this very detailed and very comprehensive presentation. It's much appreciated. And I also want to thank you for taking the time to to come and speak with us and explain this very valuable tool and helping people in precarious situations and hopefully ensuring a bit more housing stability. So to all the participants who are with us, we also want to thank you for participating in this spring session. This was a session that started on Friday, lasted to today. And I know some of you are here, some of you were here earlier this week. But as for participants and also presenters, we would really welcome your feedback. If the feedback can be sent through the website by email, it would be much appreciated. Of course, those sessions are, put for the benefit of all. And if there are topics that are of interest, if there are sessions that you felt were too short or too long, please let us know. We really try to make them as interactive as interesting for everyone. So I want to thank everyone for participating, and I wish everyone a very good rest of the day. There are other sessions on the website as well that have been announced. So I welcome everyone to go take a look and register when the registration is available. And yes, thank you, and have a pleasant rest of the day for everyone. And thank you again to our panelists.
Thank you very much.
Okay.